Welcome to week 3, DNP class 804. This is Anna, and I am here today with Courtney Campbell Saxon, who is one of the finance people that I work with at Cincinnati Children's Hospital. Courtney, tell us a little bit about your position and your role.
Sure, Anna. So hi, everybody. I'm happy to be here. So as Anna mentioned, I'm a finance leader at Cincinnati Children's. I actually support the patient services function, which Anna probably has described you in the past, but in case she hasn't, it's essentially all the nursing, inpatient, ambulatory clinics, EDs, urgent cares, pharmacy, operating room, home health, all the allied health areas, etc. It is about 7,000 of our 15,000 employees at Cincinnati Children's, and really it is the front line providing all of the direct patient care. And so my role as the finance person is to really help ensure, as we move forward as an organization from a patient services perspective, we're ensuring that we are being good stewards with our resources, that we are following and monitoring productivity, and that we are providing good benefit to the organization from a cash flow perspective. I have been at Cincinnati Children's for about 16 years. Prior to Cincinnati Children's, I actually started my career with Procter & Gamble, where I was also in a number of finance roles, and left after I had my youngest child, who's now a college freshman.
Wow.
And have been here ever since, and really just loving the healthcare environment and Cincinnati Children's.
It is, and I will just share with you, a great pleasure to work with Courtney, and her leadership. She has really impacted the nursing services here in our organization to help all of us be accountable and understand from a financial standpoint where we are and why it's so important to look at our goals moving forward around cost containment, around assuring that nurses are working at their highest level, to make sure that we are as productive as we can possibly be, so that from a responsibility standpoint, we can keep our costs as low as possible to our patients and their families. So with that in mind, Courtney, from your perspective, why is it important for nurses, especially nurse leaders, because this group really is a nursing leadership group, to be knowledgeable about the financial situation in the organizations they work in?
So I think in general, we all know that healthcare costs comprise a big percentage of our total economy, and it is one of the highest cost services that any family may encounter. Within Cincinnati Children's and other healthcare facilities, we know that many patients and families feel a significant burden related to healthcare costs. And so that being said, nursing leadership, because nurses are the front line, they are dealing with patients and families on a daily basis, 24 hours a day, 7 days a week. It's important for them to understand how actions or running a unit, etc., impacts the organization financially, because many healthcare organizations, definitely have areas where maybe they do make some margin or some positive cash flow, and then there are other areas where maybe we don't make positive cash flow, and so those offset, hopefully, and as an organization, we need to be able to generate a favorable margin, even though we are in particularly a not-for-profit, so that we can invest in the future to continue to provide good patient care to all of our patients and families, regardless of their ability to pay. So I think from a nursing leader perspective, because nursing makes up a significant portion of the overall organization, it's critical that nurses understand costs and actions, and really with the front line, providing a lot of feedback on where we might have opportunity to become more efficient. Nursing leadership and nurses in general, you see what happens at the front line, and many times you generate the best ideas for where we might have opportunity. And so I think it's critical for nursing leadership to understand how is the revenue generated, what do we generate from payers, and different payers have different reimbursement methodologies, but then also really to understand the cost structure and how one decision that's made on a unit may have a favorable or an unfavorable impact to the organization.
Outstanding. I think some of the ways that we have looked to do that here at Cincinnati Children's, obviously we do want to engage all of our staff in those efforts to identify areas. We've done that well through our shared governance structure, I think, particularly in the last year or two as we've kind of tried to really tighten up from a finance standpoint where we can identify good cost savings. From a leadership standpoint, oftentimes we may be coming to you with all these great ideas and suggestions, some of which we do have to make choices about when our resources are limited, and we know that there is maybe obviously there's always a finite bucket of money, and maybe 4 or 5 really, really good ideas about how to spend that.
Right.
What are some of the things that you take into consideration when having to make those really high level or maybe difficult choices when there are good options?
Right.
How do you weigh and measure what maybe is the most beneficial to the organization? So
I'm going to take a little bit of a different bent on that, Anna, and I'm going to answer in a little different way. So as you mentioned, nursing and nursing leaders come forward with many great ideas, and you talked about the importance of prioritizing, and that is absolutely critical. As the finance partner with nursing, I never want to be in the position where I am recommending one over the other because I'm not as on the front line. So the approach that I try to take as a finance leader supporting the nursing areas is really to talk through or think about what that prioritization would look like and ask questions. One of the things that I do on a weekly basis with the rest of our leadership team is I go out and I round on units. And I know that, in the past, finance people may not be out there on the units. The reason that I like to do that is because I like to see what the front line is dealing with, and I think I want them to see their finance support as a partner. So ultimately, I want the clinical leadership to make the decision if we're prioritizing, but with some support from a business and finance focus. And that actually is another reason that it's very good for nursing leaders to have a clear understanding of the financials, so that as we're working together in partnership and we're thinking about, okay, we have these 4 things we want to do, but we know we can maybe only do one of them, that we're thinking together about the pros and the cons and what the reinvestment might be. While we want, our decisions to be financially positive, we know that sometimes there are things that we need to do that maybe not on their own accord show a positive financial. So then we might say, okay, if we want to do this and we know it's not a positive financial, but we think from a mission perspective it's important, what other things can we do that might be able to offset that, and be thinking about things in conjunction. And so I guess I would say it's really a partnership, and I don't view myself as the deciding person, even though I'm finance. I really want it to be a partnership with the clinical leadership.
Thank you so much for pointing that out, because I think one of the really important pieces that we do want to talk about is the importance of that partnership and how do we work together, each bringing our strengths to the different roles that we play within our organizations in patient care delivery. And when that is driven by mission, that's when we have, I think, some of the best outcomes, the best ability to make decisions around that.
Right.
Oh my gosh. Thank you so much for your time today.
Absolutely.
I really appreciate it. I think this is perfect. Thank you, Courtney.
Good. Thank you, Anna.